Jerome, it's a pleasure to welcome you.
Thank you. Delighted to be here.
Yeah. The number one question faces not just US and across the world, more I think prominently here, is the cost of healthcare. Even with Obamacare, half the population is happy, half the population not happy. Affordability becomes a big problem. Accessible to healthcare is the next one. So you are trying to make this more affordable, more reachable to masses out there. And I thought, let me start with that question first.
Yeah, well, thank you. Very good question. There's data out there that shows that it costs about $2 billion or more to launch a new drug. It could take 12 years at and maybe only a 7% approval rate. There's data from Tufts University on that. And so our mission at Open Therapeutics is to really make drugs more affordable and accessible for everyone around the world. There's a lot of emerging economies. They cannot really afford the current Western pharma market right now. And we do that through collaboration. We have a website that we're launching called opentherapeutics.net. We're crowdsourcing the best scientific minds in the world into this website to collaborate to get solutions a lot faster, a lot cheaper, such that drugs can be more affordable for everyone around the world.
You had also talked about opening up the platform for others who can leverage that. And technology is open source pretty much in that aspect. It's more like Android. And you said,
our technology is called Therapoid. And, what companies will tell you, or senior executives in companies around the world, is that no matter how smart your people are, there are smart people or smarter people other places. And so we want to make sure everyone is engaged, the best minds in the world, to drive solutions. And collaboration should have no borders, right? So this is a global engagement process, and we feel that Therapoid is the way to do it. There's going to be a lot of other benefits from our site as well. We have partnership organizations that will be running RFPs through our site. We like to use the analogy of honeybees and honey. We don't want to just attract scientists and medical professionals, have them sign up and then leave. We want to add value. So one of the things that we're doing is we're not just inviting people to a portal saying, give us an idea to solve a problem. We're also providing technologies for free that our own internal scientists have developed or that we've out-licensed from universities. And we're saying, hey, you can access these technologies to advance in therapeutics.
So it's holistic on one side. On the other side, from the investor's perspective, what is the business model then?
Great question. And I knew you were going to ask that question. I like that question. So we always reserve the right to sell some of our assets that we call non-operating subsidiaries. We sold one earlier this year for $2 million, primarily in the energy space. But we mostly play in therapeutics and healthcare. But the guts of the business model is monetizing the web platform. Right? So we reserve the right to sell subscriptions if we like, although we're letting everybody in free initially. But we can upgrade if we decide to do that later. That's not really on the top of our priority list, the subscription piece, because we really want people to be freely engaged and freely involved. But we also do targeted advertising, right? If you're looking for a certain type of scientist, it might be a rare scientist, we have artificial intelligence built into our site. We can take your link or your ad and put it right in front of the 10 scientists that you're looking for. We can also sell data and analytics, right? Which is a big part of our monetization strategy, selling data and analytics to large pharma companies and larger companies, because we have community managers in our site and a lot of very talented scientists, and we're able to observe as to what they're collaborating on. Right? So there's a lot of different ways we can monetize the web platform.
Earlier we touched upon the amount of money and the amount of time and resources it takes to develop a drug for leading manufacturers. And then it comes to the generic market. There are some in the developing world who come out with generic versions which are more, I think, affordable across the globe, especially in the continent of Africa and Asia as well. What is your take on this effect of major producers saying that this is the amount of money you spend when the generic manufacturers are fighting against these giants? I'm sure there is a place in between where they can meet.
That's a great question. It's sort of a balancing act, right? I mean, I don't want to say that there are bad players out there. In many cases, this is just the nature of the industry. It costs a lot of money to launch a drug. You know, a large drug company can get to a clinical stage 3, and the trial can fail, and they've invested a lot of money. I don't want to get into what's built in terms of creating return on investment for their shareholders. I don't have all that data, but we believe that we can coexist with these large pharma and large drug companies and help drive down the cost, because there is data that shows when there's greater collaboration early on, there's a much better chance of a clinical trial passing, right? You got more minds involved, some of the sharpest scientific minds in the world, collaborating inside opentherapeutics.net. Perhaps those large pharma companies can grab some of our technologies or some of the results of this collaboration, wrap their brand around it, wrap trade secret around it, and commercialize it and take it to the next level, because we're on the R&D side. So we feel that if they work with us, we can together drive down the cost of drug development while also allowing them to access the best scientific minds in the world, because I feel that companies need to get over the not invented here syndrome. You know, it doesn't have to be invented there. You can access great ideas,
right,
great technology from outside of the company, right, and then advance that. We feel that we play a major role in that at Open Therapeutics.
Great, great. Thank you. Appreciate you coming and sharing your thoughts with us, and good luck for the good work you do.
Thank you.